Welcome back to It's Personal. It's Personal is brought to you by Gundersen Health System. I'm Chris Stauffer. If you're paying attention to the news, you might have read or heard about the fact that there were several hospitalizations in the state of Wisconsin due to vaping. Now, if you don't know what vaping is, well, you're going to have to get up to speed because the kids do, and young people are certainly doing it at a high rate and a higher and higher rate each day. Joining us to talk about this is Dr. Todd Mahr, pediatric allergist at Gundersen Health System. Thanks for being here.
Thanks.
Hey, we've talked about this in the past on this program, and it's not going away. We know that. But before we talk too much about vaping and these hospitalizations that occurred in the state of Wisconsin, I think we should probably talk about a brief history of vaping. Where did it come from?
Yeah, and that's actually very interesting. People might think, vaping, it's been around a long time, and e-cigarettes have been here forever. But actually, 2007, e-cigarettes first appear in the U.S. market. They came from China, originally developed, I think, as an alternative to cigarettes in China, and made it in the United States, and were kind of a fad thing to begin with. And about 2009, the FDA decided they needed to try and regulate e-cigarettes because they were being used more and more and regulated as a drug or a medical device. The companies then sued, and they wanted to be regulated as a tobacco product. In 2011, FDA announced that it would move forward with regulating them as tobacco products unless the manufacturers stopped making that quit smoking claim. And that was one of the problems. They were marketing it as a smoking cessation product, which it really was never intended to be, or had any data behind it.
And they're still kind of doing that.
Oh, yeah, they're still out there. And, a lot of people think, I can move to this and that's going to help me quit smoking. And there's mixed data on it, but one of the best studies was published in New England Journal of Medicine about a year ago now, where half the population went on nicotine patches, half of them went on e-cigarettes, and they looked at them a year later. And if you look at the data just on the surface, the people who were using e-cigarettes were less likely to be smoking cigarettes again. Because, when you try and quit smoking, you fail generally. You have to try 4 or 5 times before you succeed completely. And people would say, look at that. There were more people who really were basically off cigarettes by using e-cigarettes. No, when you look and drill into the data, 85% of those people who were using the e-cigarettes as a method of quitting smoking were still smoking e-cigarettes, whereas the other ones had used the patches and had quit smoking or were no longer on the patch.
Weaning themselves off
right,
of it.
So they're basically not getting any nicotine from that standpoint. So it's only 4 years ago that the FDA issued its proposal on how they would regulate e-cigarettes, and that then was finalized in 2016. And 2017, they announced manufacturers will have to submit e-cigarettes and for review in 2022, and that's where some lawsuits occurred. American Lung Association, a variety of others, said, wait a minute, 2022, you're going to wait that long? We have seen steady increases to the point of 20, 25%, 30% of youth, meaning middle schoolers and high schoolers, have said, yep, I've tried it. And we can't have that continue.
I think that might be a little bit of a misleading number because many youth are afraid to talk about the fact that they're not only trying it but using it on a regular basis. And if you talk to youth these days, and you certainly do on a daily basis, they know all about it, much more so than their parents or adults. And there's unique ways to, I guess you could say, hide what are called pods.
Right.
I'd really like you to talk about that because many parents out there or grandparents are listening and going, well, what's a pod? What's it look like? And I've never seen my child around it.
Yeah, and that's what's changed. The original e-cigarettes were these big things that looked like monsters with a little, a large place you would place the liquid, and then it had a mouthpiece or something like that, and they were pretty obvious. They were called mods and other names. And then the companies got into it and made them look like cigarettes because the market was more adults who were smoking and wanted it to look like a cigarette. The end glowed like a cigarette when you used it. And then they've evolved. Juul came on the market, and Juul was a game changer. And it's only been out for a couple of years. And Juul has the pod, and the pod is technically filled with nicotine juice, and their nicotine juice is a nicotine salt, so it's more concentrated. So let's back up one step. What's in an e-cigarette? You have a battery, you have a coil that heats, and then the juice somehow is put into that coil so it vaporizes. And there it's called vaping. Okay? Now, kids, you're right. I talk to kids all the time, and you can't ask a kid, are you using e-cigarettes? They half the time will say no, because they're not. They're using a Juul. So they're juuling, they're vaping, they're Sorening. Soren is another new product that kind of looks more like a small iPhone, okay, and contains a lot of juice, and you can refill it. So that one's becoming popular. All you have to do is Google YouTube, and you can find basically a YouTube video on how to basically break into a pod and fill it yourself. Pretty dangerous. Mm-hmm. And that's what's happening, and that's what we think when we talk about those youth you mentioned in Milwaukee. There's probably a number of them who weren't just smoking e-cigarette, but their juice contained maybe marijuana or other things, and that led down the path. But we don't know. None of that's public knowledge.
And that we're talking specifically about the hospitalizations
Correct.
that we mentioned off the top of this segment that have occurred in the state of Wisconsin, somewhere around 6, 7, 8.
Yeah, 8 of them in the month of July have been reported at Children's Hospital in Milwaukee, and not all the reports are out, and they really came to the hospital with lung problems. And that's the issue. This juice is what it's called, can be anything. And it's the wild, wild west. There's no regulation out there. The FDA is not regulating. Parents may think, well, it's being sold at these local convenience stores or these vape shops, so therefore it must be safe because it's on the market. No, we don't know what's in it. It's an unknown entity. There's a lot of youth who, in some surveys, would say, no, I'm only doing water vapor. I'm only doing flavored water vapor. And when they actually check, basically there's nicotine in there. And they had no idea. And the nicotine is addictive. The other chemicals cause problems. And the flavoring is even now being shown to have medical issues with it.
Interesting. And we do know a little bit about what's in it. We know the volume that's in it, that one pod equals how many cigarettes?
Yeah, I mean, that's what's really scary is you might say, well, okay, they've got this juice in here, and it can't be that bad. Well, one Juul pod has 41 milligrams of nicotine. That's equal to 41 cigarettes. It's 20 cigarettes in a pack. That's 2 packs of cigarettes. And so that's a lot of nicotine. The Sorens, which are these new ones, have 90 milligrams of nicotine. That's 90 cigarettes. That's a lot. And some of these kids get in these binges. And again, remember what nicotine does. And the audience may not understand. Nicotine is a chemical. You inhale it in your lungs, and it goes almost rapidly to your brain. And there's pleasure centers in your brain that nicotine bind to. And it's a pleasure response. And that's what's devious about nicotine, basically, and that's why we've had problems with cigarette smoking all along. That set point of I smoke, I relax, I feel good, I have some, quote, pleasure, so to speak, that resets and gets raised. And so to get that same response, you have to have more nicotine, and you have to have more nicotine, and that's a vicious cycle. And to think that that's not going to happen to a young brain even worse, you're being very naive. And that's our concerns in healthcare, is that these kids down to high school and now middle school are inhaling these products and exposing their brain, their developing brain, to nicotine and other chemicals, and we don't know exactly what it's going to do, but we know it's not good.
We're talking with Dr. Todd Mahr, pediatric allergist at Gundersen Health System, about the problem of vaping. We're going to take a quick time out, and when we come back, we're going to talk to him about what's happening in the state of Wisconsin to do some regulation and what's happening on a national level for regulation for vaping. That's all next on It's Personal. It's Personal is brought to you by Gundersen Health System. Welcome back to It's Personal. It's Personal is brought to you by Gundersen Health System. I'm Chris Stauffer. The topic is vaping. Dr. Todd Mahr, pediatric allergist, is here. What's happening in the state of Wisconsin as far as regulating vaping? We talked earlier about the fact that there has been up to 8 people, 8 teens, hospitalized with some lung damage due to vaping. I would think that the legislature and lawmakers are raising red flags, and that there might be something happening in the state. But you're probably going to say that we're a little bit behind other states.
Right. And I'm smirking because you would think that, but unfortunately politics get ugly. And so, yes, in the state of Wisconsin, in the governor's budget, he proposed a 71% tax on the e-cigarette juice to bring it to basically parity with cigarettes. And that's a tactic to basically create a hurdle for youth to buy, right? And you might say, well, we don't need that tax that high. Well, A, it's revenue, okay, and that revenue could go back in for tobacco cessation and or health problems, et cetera. It basically creates that hurdle and is inhibitory for kids to buy when they're priced so high. Unfortunately, what happened is through the legislature, they basically dropped it to 5 cents for a milliliter of juice. So on a usual pod or a usual pack of e-cigarettes, it would be $1.50. Normally, it would have been almost $14 to $15. So it's meaningless. But now the tobacco industry, which was behind that change, obviously, can say, well, wait a minute, no, you just in this budget added a tax. You can't come back to that well and add another tax. Well, it was a nickel. Give me a break. That was nothing. Tobacco 21 is something a lot of us are supporting. The drinking age is 21. There's 14, 15 states now and about another 20-plus communities that have raised the age of purchase for tobacco products, including e-cigarettes, to 21. And so Tobacco 21 was proposed at a federal level way back when and has kind of died out. That tells you how influential, again, the lobbying that goes on behind the scenes with all of this. So we're working on smoke-free protections. State of Minnesota, basically August 1st now, e-cigarettes are included in their smoke-free air in all indoor places. The Tobacco 21 policies, a number of states have joined, but Wisconsin's not quite there yet. And we have some communities that are working on it. We need to put funding behind tobacco cessation programs and help smokers quit and get them the education. We need to increase tobacco taxes. Okay, we should have the e-cigarettes taxed higher, and we should look at actually cigarettes and little cigarettes and brown cigarettes and all the rest of the things that kind of slip through the cracks.
And I know you've heard people say that the expense of tobacco products has made them quit.
You're exactly right. I mean, I've seen parents who, basically once it got to that point, that was the motive for them to quit when they looked down and said, here's what I'm smoking, and boy, I could have a better vacation every year if I quit and didn't spend all of this. And one thing that a lot of people hear about are flavors and prohibiting flavors. And that's important too, because these flavors are answer this to yourself if you're a listener. Do you really need something bubblegum or cotton candy or creme brulee flavored? No.
Right. I mean, they're not marketing that to you and I. They're marketing that to young adults.
Right. Yet they'll stay there. They'll stand and say, nope, we're an adult product only. Oh, give me a break. That's not, adults don't really want any of that stuff. And the flavors now, there's good research showing that those flavorings have chemicals in them that when they sit on the shelf may basically create acetals and other products that when you inhale them are going to cause more damage. We do know there was a recent study published with cinnamon and mint that specifically they attack the lining of the blood vessels. So not your lungs, but the lining of the blood vessels, so your heart and your lung, and creating problems.
The health implications are very real,
right.
And we're seeing that not only from the hospitalization, but we really don't know yet the long-term effects.
Yep.
But more and more data is coming out all the time.
Yeah, and that's what's good about this is we're beginning to get some data. What's bad is we're just beginning. And so people are wanting answers right now, and youth, their brains don't think that way. They think, I'm a youth, I'm going to live forever. I can do stuff you didn't do. Grandpa's 95 and he smoked a pack a day. Look at him. And they don't quite put it all together like they should. And unfortunately, we need our parents to talk. So the American Lung Association has a nice program called Vape Talk. It's vapetalk.org. You can go there, and there's tools for you to talk to your youth. Okay, there's little videos, a minute long, that make basically, that remind you the youth really want to be talked to. They'd like to know. Okay, and if you don't fill that gap, they're going to get it from their peers. And as we all know, that's not a good source of information for you.
Right. And seeing it on social media is certainly helpful. You mentioned the American Lung Association. I know you've been heavily involved in that for a number of years. What other things are they doing to tackle vaping?
Well, I mean, they've been involved with a lawsuit against the FDA to say you got to start moving quicker. They're supporting all these Tobacco 21 programs in the states. They have good cessation programs, and they're basically taking these, like the vapetalk.org, and moving into the social media market. They're cooperating with the FDA. The FDA has now started their own ads that I think it was last week they were released that basically are show a magician and show how basically it's a magic act, and it's, look at what this is, and trying to get the youth to realize that this isn't water vapor. This isn't something just benign. There's some behind-the-scenes things that go into this, and you need to understand that.
And who knows, we could find out that this is worse than tobacco products that, smoking that...
Well, that's a great point that we haven't hit upon, but it's easier to use this product because it's not as harsh. It's not a burning leaf and paper and 4,000 other chemicals. So it's not as harsh on your airway. It's not as harsh when you smoke. So that's these 8 youth probably, if we got down and could probably interview them, they probably smoked a lot because there wasn't that bad. They didn't basically feel that. You sit down and try and smoke a pack of cigarettes, any smoker will tell you that's a lot of cigarettes. Okay, and a pack-a-day smoker, they're going to get hoarse. They know they're not doing what they should do. Somebody smoking a pod a day, it may not register with them at all.
Before we go, I do want to see if there is something that parents should be looking out for, conversations that maybe they should be having with their high schooler, their middle schooler about vaping. What's your suggestion there?
I mean, that's a great question. I mean, I just got an email from a friend on the East Coast who I'd sent him some information on vaping because he had heard I was doing a talk on it at a meeting coming up, and he couldn't attend. And I sent it to him, and then he basically emailed me back saying, coincidentally, my daughter had a sleepover, and we caught them vaping. And they were doing it in her bedroom, and they were blowing it into the sleeves of their clothes, thinking they could hide it, and that they picked up on it. And then sat down and had the frank talk that they had to have. And he basically outlined some of the information that he had and had that conversation. And I think these were middle school girls, and they want that conversation. They think they're cool. They think there's no problem with it. And as he closed, he said, their eyes were opened, and they realized that, it's got harmful effects to it, and that, mom and dad love them and want that to be information that they can have to make a decision. And ideally, the problem is, look at how easy it was for them to get it.
Right. And while they were, discovered, from what I understand, high school students are being able to take this almost right into the classroom because they can hide it so easily.
The Juul product and the Soren products are small enough, and they don't look like cigarettes or don't look like anything else. The Juul looks like a USB device. Mm-hmm. And these kids, and there's not as much odor or smoke, but it's not smoke, but vapor even from these anymore. It used to be they were made to make a lot of vapor because it was cool, and now they're being manufactured so there's not as much vapor coming off of them. And it's an aerosol. It's not a gas. It's not a vapor. It's actually an aerosol, which means it contains things. And it contains particles that these people are inhaling. And they'll exhale into their sleeves or, down. And teachers are saying, hey, we can't police all this. We can't, help us out.
And they're right. They're right. So have a conversation with your child because they know about it. They're talking about it. And if they're not doing it, are certainly aware of the potential for it to happen, not only in their classroom, but, certainly anywhere around them.
And you're not on your own. You have organizations like the American Lung Association, Gundersen Health System that are there, that have tools for you. Just talk to us and find out what we have available.
Yeah, great advice. Dr. Mahr, we appreciate your time, and good luck in spreading the word about vaping because we're all trying to catch up, really, to the youth, that's for sure. When we come back on It's Personal, we're going to be talking about the Steppin' Out in Pink. Coming up in September, we'll have Debbie Crona here to discuss. That's all next on It's Personal. It's Personal is brought to you by Gundersen Health System.